a couple of things before we introduce Amber. Throughout the webinar, you can type questions into the Q&A box. Please try to use Q&A. It's going to be easier for us to follow along and follow up since we have so many people on this webinar. So if you use Q&A, we'll try to get to everything at the end of the presentation, but you can certainly type your questions as we go along. We'll get to the end, we'll answer as many as we can, and then we will be able to, as long as you don't ask your questions anonymously, we'll be able to follow up after the presentation and get back with everybody if we've got your email addresses. This will be posted on the website within 48 hours of the session, so that if you find you'd like to go back and look at it or you have any more questions, you can certainly feel free to go back to the website. At the end of the presentation, we'll also include some information on social media and how to contact the benefits division of BHR. So I'm going to stop now so we can get to what we need to get to. And Amber from Wellmark will be doing our presentation today. Welcome, Amber.
Thank you. There we go. Hope everyone can see that just fine. So good afternoon, everyone. My name is Amber Watts, and I am the Account Service Representative at Wellmark for the state of South Dakota. Today, I'm going to show you some of the functions of the Wellmark website and talk about the extra add-ons available to you as Wellmark members. There is a lot of information to cover, but my goal today is just to show you the many resources that are available to you, in addition to our dedicated health advocate team located in Sioux Falls. I am very excited to welcome you on behalf of Wellmark, and our team does look forward to getting to know you and taking care of your healthcare needs. So with that, let's move on with the presentation. The first thing I'm going to show you is your ID card, what that looks like, and a few of the features of that. Then I'm going to show you how to register on the Wellmark website for your My Wellmark account. We're going to go through a lot of the My Wellmark features and then some prescription tools. And then again, at the end, we're going to have questions. So this is what your Wellmark ID card is going to look like. So at the top right, you'll see your customized ID card has South Dakota right there. And to the left, it has our logo. Directly underneath that, when you get your card, you'll see your name. So the primary subscriber's name will be on the card, and spouse and children will use a card with that primary subscriber's name on it. Directly underneath that, let me get my laser pointer here. Directly underneath that is your ID number. So the first three letters of that ID number is what we call a prefix, the SDF. If you're not logged into your My Wellmark account and you want to look up providers to see if they're in network or out of network, you can click on the homepage of the Wellmark site, scroll all the way down to the bottom of the page, search for a provider. So there's a provider search down there. And then you'll use this SDF to identify your plan and put in your location, and you can look up providers on that website. So in-network providers, you're going to have your in-network benefits. Out-of-network providers are covered under your plan, but it may have additional cost share for you. It costs a little bit more for out-of-network providers. So it is good to check the website for in-network providers. Again, once you're actually in our system and you create your login, you will not have to use that to look up providers once you're logged in. Directly underneath that is your group number. And then the next three lines here contains all the information your pharmacy is going to need to run your prescriptions through your Wellmark benefits. And then over to the right, depending on which plan you are on, this one is an example of the Roosevelt plan, and it shows the copays. So depending on which plan you're on, it's going to have a different plan name and information on there. And then over to the right here is the back of your ID card. And here is the one phone number you need for all of your needs, basically. Any questions you have for our health advocate team, it's basically customer service, and the condition support team. This is the number you'd call, the 800-846-9183. If you call after hours, you will have an option to kind of opt out to the Be Well 24 line, and I'll talk a little bit more about that later. I do want to advise that as soon as once you get your ID card, the first time you go to the pharmacy or your doctor's office, be sure to show them your new ID card and let them know you have new insurance. So there won't be any delays in getting your claims filed and also picking up prescriptions. Oops. So next we're going to talk about registering at the Wellmark website. So you'll just go to www.wellmark.com. Sorry, there seems to be a little delay here. And you will need your Wellmark ID number or your social security number to register. At the top of the page, and this is the desktop view, at the top of the page, you'll see the login register button. You'll click on that. And then on the next page, you'll see a purple register button. So the first time you go out there, you'll want to click on that, create your registration. And then for any subsequent visits, you can just simply on this page, enter your user ID and your password. We also have a Wellmark app. So if you have a smartphone, if you go out to your app store and type in Wellmark, you can go ahead and download that app for free. It basically offers you everything that you can access on the Wellmark website. You can access your claims, view your benefits, find a doctor or pharmacy that's in network. The cost estimator tools are also available. We'll talk a little bit more about those later. If your smartphone does have the capability, there is fingerprint and facial recognition technology. And my favorite thing about the app is the digital ID card. So anyone in your family who's 18 or over can create a login and pull up a digital ID card. This is really great for college students because they usually don't carry their medical ID card around. It's really great if you have a younger kid and you gave them the ID card and they didn't return it to you and you were at the pharmacy needing to fill a prescription, you can just simply pull up your ID card on your phone and get your prescription filled. The My Wellmark features. So this is the section that's going to have a lot of information. And I don't expect you to remember it all. I just kind of want to give you a sense of what's out there. And so you can kind of go out there and peruse on your own time once you have a login. And Michelle's also going to post a link to the demo site so you can kind of play around in there yourself and see what's out there. So once you're logged in, you're going to be on this home page, which is this first tab up on the left-hand side. It's going to say welcome and whatever your name is. And then at the top right here, there's a quick link for messages, and we'll talk about that a little bit later. Your profile, and this is where you can update your username, password, set your preferences, and then the log out button. This first page is just going to have quick links to a bunch of different stuff. It's you can find a provider, view your benefits, see your latest claims, order ID cards. So you can see over here, you can order an ID card. You can order one mailed. You can download it and save it to your phone or email it to yourself. So you always have access to ordering a new ID card here, or you can call into the health advocate line and they can order one for you. I'm not going to go into detail on everything on this tab because they're covered in other tabs as well. So the next tab here, oops, helps if I hit forward. The next tab here is the claims tab. So up the top here, you can see there's different selections. So the one it's going to default to is this all claims, and it's going to show you your accumulations for your deductible to date, your out of pocket, and a spend report. I really like the spend report. It's really helpful to, it'll basically, you can select a date range. So you could select by calendar year or specific month. And you can print that out and take it to your accountant when you file your taxes if they need to know how much you spent on medical in the year. And it's also helpful too, if you have a lot of medical bills coming in at the same time, to kind of pull that up and kind of compare the bills to the claims that you have in there. And you can look for specific providers on there as well. Down here at the bottom, you can sort your claims by family member. So you can show claims for every family member, or if you are looking for claims for just one person, you can select their name and it will filter down those results. The same for the date range. You can filter down by date range. And then claim status, whether it's pending or it's paid or denied, whatever the case might be. So this is really nice because you can tell if a claim has been received by us and if it's in process. And then the claims type. So this you can filter down for medical or pharmacy. Then up here at the top, the explanation of benefits tab, you can access the explanation of benefits down here when you have a new one. But if you want a list of all your explanation of benefits, you'll go to this tab. And again, you can sort those. And then there's a tab here for claim forms. So if you do go to an out-of-network provider, those services would be covered. But most likely you will have to file your own claim and submit that to us by mail with supporting documentation. So that's where you'd go to find those. One thing I forgot to mention when we were down here is there is a My Notes column. So you may have a claim, you want to put a note in there what that visit was for, or maybe you had questions about the claim. So if you need to call into the health advocate line and ask questions about the claim and your benefits and you get information back and you want to remember that, you can actually type in a note for yourself and it's going to be stored here so you don't write it on a piece of paper like me and lose it. Super useful tool. So next we are going to look at, an example of the explanation of benefits. So the explanation of benefits is going to show you each claim. It's going to tell you the date of the service, the provider information, the claim number. It's going to give a brief idea of what it's for, like office visit, lab. It's going to tell you how much the provider charged, how much the network savings is. So the network savings would be the amount that the provider writes off due to their contract with us. It's going to show how much we paid. And then it's also going to show you what amounts applied to, whether it be deductible, copayment, coinsurance, if there's an amount that's not covered. And to the right, it's going to have notes. So particularly important if you do have one that was denied or not covered for some reason, it's going to tell you why. And then it's going to summarize what your total responsibility is for that particular claim. If different family members have claims that are processed within the same time frame, they may be on the same explanation of benefits. So Mary might have one claim and Jimmy might have another claim. They're all going to come on the same print job. One feature that you can sign up for is digital explanation of benefits. So where I showed you on your profile, you can change your preferences. You can elect to receive only digital explanation of benefits. And when you do that, you will actually get an email notification when you have a new explanation of benefits for viewing. And then you just simply go out to the Wellmark website, log in, and you can access those explanation of benefits. If you are like me and you hate filing or having to shred papers and having stacks of things everywhere, sign up for the explanation of benefits and you can get rid of all that clutter. This is an example of the Wellmark spend report. So it has a list of all the claims for the date range that you select, whether it's the past year or a specific month. It's going to have all the same information. It's going to have dates, claim number, amount charged, network savings, how much we paid, amounts that went towards your deductible, copay, coinsurance, an amount you owe. This example doesn't show it, but it does also total up the columns by family member. And then at the very bottom, it will total up, you'll see, for the whole family. So super useful tool. The next tab is the coverage tab. We're going to talk about the medical coverage here. And then this pharmacy tab we'll talk about a little bit later. So I can show you some examples. So on here, it does have different information about what's covered, additional details about the plan. It's going to have your deductibles, copays. It's also going to have further down here, it's going to have a benefits used. And if you click on that, it's going to tell you if you've had your preventive visit for the year. So sometimes you don't know exactly how a provider builds something, and you can go in there and see, oh, I've used my preventive visit this year. I have to wait until my next benefit period. It also lists out there anything that might have a limit on it. So for example, chiropractic, you do have 20 visits that you can go to the chiropractor for. And after 20 visits, that provider does need to submit a treatment plan. And the in-network providers are going to go ahead and do that automatically for you. But if you go to an out-of-network provider, you might want to keep track of that to make sure that a treatment plan gets submitted. An out-of-network provider may not want to do that, but most providers are in network, so you shouldn't have any issues there. There's quick links to additional resources over here. And need a cost estimate. We're going to talk about that in a minute here too. So under Find Care here, it does have the phone number for the Be Well 24 line. And this is basically like a concierge service. And I'm going to talk about that again in a minute. Down here at the bottom is where you can search for a provider. And again, you do not have to put in your prefix. It's going to default the search to your address that you have on file. So you can change that location once you're in there. You can change the location to wherever you want. Even if you live in Pierre and you want to see a provider in Sioux Falls, just simply change the location to Sioux Falls and you can find in-network providers. And then here's the link for Find a Pharmacy. Also information about Doctor on Demand here for virtual visits that I'll talk about in a minute. And then cost estimates. Again, the pharmacy we'll talk about a little bit later, but I'm going to show you an example of what it looks like when you get a medical cost estimate. So with the medical cost estimate, you can estimate what and again, it's an estimate. It's not a guarantee that that's exactly what it's going to cost because it's going to vary based on what the provider actually bills as a service. But you can estimate your cost by type of coverage. You can change the location, refine the search, refine the search. So if you click here on medical costs, sorry, there's a little delay here. Doesn't want to click. There we go. So right here, the next page, it's going to have all these options, but what you're going to want to select is this little $ one with estimate your costs. And once you click on that, you can type in the type of service that you're looking for. So I'm going to use chiropractic treatment as my example. And as you start typing the name of the service, it'll kind of have a drop down and you can select that. So you can search for MRIs. If a provider is giving you a specific procedure code that they would bill, you can look it up by the procedure code. Not everything is going to be in here. It's just going to be the most common procedures. And then the results here, this is for my particular plan, and I have a $25 office visit copay for chiropractic. Yours is going to vary by plan. But as you can see here, it has an average total cost for that particular provider. And again, depending on what the provider bills, your amounts might be slightly different. And again, this is an average, but it kind of gives you an idea. So if you're going in for a more expensive procedure, particularly, and you're in a high deductible plan, it's kind of nice to go out there and be able to compare providers and the cost and see if you can get with a lower cost provider. Next, we're going to talk about Doctor on Demand. So with Doctor on Demand, you can see a doctor on your smartphone, tablet, or computer from anywhere. I've done it while out running errands before on a Saturday, so it really can be done. And as soon as you're effective, I do recommend you're downloading the Doctor on Demand app to your smartphone or creating a login at drondemand.com. To sign up, you will need your Wellmark member ID card because you're going to have to put in your insurance information. Once your insurance information is in there, again, you'll want to wait till you're effective with us so it'll verify. They electronically verify those benefits with us. So before you go for a visit, you can actually see how much that's going to cost, whether you're on a copay plan or a high deductible plan. And you can get treatment for medical and mental health. And just so you know, if you have anyone in your family over age 18 will need to create their own login. A parent would go ahead and put the child under them on the app. So you can access or add your child that's under age 18 to yours so that they can access services. So the well-being items here, I'm going to talk about most of this stuff on the following slides, but I do want to point out this is the tab. If you're part of the pregnancy care program, this is where you can come out to complete a pregnancy assessment. And if you click on this, learn more, that's how you get to that assessment. And there's also Count the Kicks app, Text for Baby, additional resources out there for you for that program. You can also call into the health advocate line in order to, you can kind of go through the survey with them and sign up that way as well. So the Be Well 24/7, I don't know why it's not populating properly. It's basically a health advocacy line. You don't need to, let's see if we can get that, there we go. The health advocate line, you can actually get help coordinating care, locating specialists, scheduling home care services. You can speak to an actual nurse. Maybe you're concerned about side effects of a new drug. It's the weekend and your kid like hurts their finger or something and you're trying to figure out, oh, are we going to be okay? Or should we, go to the ER or an urgent care? They can kind of give you a little bit more direction. They can also help you better understand your health condition and also learn about how Wellmark can help. And this is something you don't need to remember this number. If you do call Wellmark after hours, there will be an option to opt out to the service so that you can get advice outside of business hours. Blue 365 is a discount program available to our Wellmark members. So you can take advantage of discounts and savings on fitness equipment, Fitbits, tennis shoes, hearing aids, LASIK surgery, all sorts of stuff out there. And there is a sign up address here, but if you're logged into the My Wellmark, you can access that from there, create a login, and you can view all the discounts available to you. And you can also sign up to have some exclusive deals emailed straight to your inbox. The My Plans tab doesn't have a whole lot of information that you won't already have at your fingertips, but it has like your ID number, what kind of coverage you have, whether it be individual coverage, family coverage, has the group number, benefit period. And over here to the right is where you can enter information about your other insurance. And this helps us to coordinate the benefits with the other insurance. So if you have other insurance on file, you can go in here and update it if that insurance ends. Or if you get new insurance or one of your dependents has other insurance, you can input that information there. You can also call into the health advocate line and they would be happy to go ahead and help you with that as well. The last tab here is the help tab. So this is where you can send a message to the health advocate team. Let's say you have a question about one of your claims, or you have a question about your benefits, anything like that, and maybe you don't have time to call during the day, you can send a message over. Sometimes if it's a more complex question, it might be helpful to put your phone number on there so they can reach out to you directly to ask you additional questions. Sometimes they may need more information and may message you back. So there might be a little bit of back and forth, but it is convenient to be able to send questions at your convenience versus when the phone lines are open. And just to let you know, it's not a live chat situation. It is a message that goes in and they do work that and send the message back, but I would expect an answer back pretty quickly, but probably not the same day. Then the last thing on the My Wellmark site that I want to show you is the identity protection. So you do have free identity protection available to you as a Wellmark member. On any page when you're logged in, if you just scroll down to the very bottom of the page to the gray area under Do More, you'll see identity protection. And if you click on that, it's actually going to take you out of the Wellmark website to IDX. IDX does provide free identity protection. It has $1 million identity theft insurance, 100% recovery guarantee. And this little screenshot on the left side here is what it looks like on their website. So when you get there, you're going to actually scroll down a little bit and look for this Wellmark member plan. Click on enroll. You will need your Wellmark ID number to sign up, but it's absolutely free and you can sign up to get notifications. They do a monthly kind of update to let you know if there's anything going on. If there was something suspicious, you'd get a notification right away. Next, we're going to talk about the prescription drugs. So looking up drugs on the Wellmark formulary, I'm going to point out here too, this is on the Wellmark homepage without being logged in, just wellmark.com. This is where you'll go. I mentioned earlier that prefix on your ID card. This is where you go to find a provider and see if they're in network. So while we're on this page, I figured I'd point that out to you. And again, if you go to an out-of-network provider, I don't know if I said this before, you do not need any kind of referral or authorization. It's just going to be a higher cost to you. In-network's definitely going to be saving you money. So under Do More, you're going to see prescription drug information. So if you click on prescription drug information, you're going to see the Wellmark drug list on the next page. And then your drug list is the blue RX Value Plus. It's the second one from the bottom. So if you click on that, sorry, there's a little delay. There's going to be a few ways that you can search for drugs. So you can search by the drug name. If you start typing in the name here, there'll be a drop down so that you can select the drug you're looking for. You can look by therapeutic class, so the type of drug that you're looking for. There's also a PDF version of the drug list. I do want to give a little disclaimer here though. If you do save the drug list, there are periodic drug updates. So it's only as good as the day that you download it. And then there's the legend. So the legend here shows you the different tier levels of the drug. And I'll show you what that looks like in just a minute. So it'll tell you if it's tier 1, tier 2, tier 3. It'll tell you if there's a quantity limit, if a prior authorization is required. It'll tell you if it's non-formulary, if it's a pharmacy durable medical equipment item. So you can cross-reference with your benefits. So in our example here, we're going to look up Crestor, and under your plan, you can see here, point with the pointer. Crestor is a non-formulary drug. So that means it's not going to be covered under your plan. But if you look over here to the right, there's Find Alternative Drugs. And if you click on that, it's going to come out to this screen. So you can still see the Crestor we selected as non-formulary. And then it's going to show equivalent drugs. So an equivalent drug is a drug that has the same active ingredient. So it's basically a generic of the brand name. And as you can see here, this one is a tier 1 drug. And you can also see this PV, which is preventive. Now this would be preventive for the high deductible plans. This would be basically HSA preventive with the IRS listed drug. And so you would look at the tier 1 preventive cost share on your benefits. And then I'm also going to show you the cost estimator so that you can see a little bit more how that works. And then there's alternative drugs. Alternative drugs are drugs that have similar ingredients. So they're not an exact match for the drug, but there's other alternatives here. And this is really helpful if you are having a conversation about prescriptions with your doctor. They have access to this too, and they can look and see what other drugs are out there, what tier they're on, and maybe help you with some cost savings. So the pharmacy tools, if you remember, we were on that coverage tab of the My Wellmark site, and we looked at the medical. So I wanted to show you the pharmacy here. If you click on the pharmacy tab and you click on prescription resources, it's going to take you out to the CVS website. And this is what that's going to look like. You will create a login there. If you access it through the My Wellmark site, create a login. The next time you go to My Wellmark and you click on prescription resources, you're not going to have to log in again. And it's the same thing with the Wellmark app. You will be prompted if you try and do a cost estimate on a drug or look up a drug, you're going to be prompted to log into CVS. Once you've done that once, you're not going to have to do it again when you access from your Wellmark login account. So here you can check a drug cost, track your drug costs, locate a pharmacy, check drug interactions. And this is also where you would sign up for mail order and CVS specialty drugs. So this here is how you're going to look up the drugs to see what they're going to cost under your plan. It is based on your specific benefits. So once you're effective with Wellmark 7.1, this is going to be completely accurate for your plan that you've selected. It's going to help you identify some lower cost options, and you can compare between generic and brand name. And then also you can change the pharmacy, and I'll show you that on the next page too. So different pharmacies might have a different cost for a particular drug. So this is what it's going to look like. So the first thing we'd want to do is start typing in the name of the drug. And as you can see, a list of drugs comes up below. So we're going to select the one that we want. And then over here, it's going to default to the pharmacy that you selected when you registered for CVS. And so every time you go in there, it's going to default to that one. You are able to change it for your search if you want, if maybe you're traveling, or maybe you're in a different city or whatnot, or you want to check what the cost is at a different pharmacy. This is where you can change that. And then you click search. Then on the next page, this isn't accurate for your plan as far as the Crestor brand name. This is just a sample slide just to kind of give you an example. So as you can see on the left-hand side there, it's got cost for a 90-day supply by mail order, and underneath that, a 30-day supply for store pickup. And that first column is the brand name Crestor, and you can see how expensive that is. Then if you look over to the right, the generic would only be $10 for a 3-month supply or $5 for a 1-month supply. Again, this is not for your particular plan. This is just an example of what it's going to look like when you go in there, so you can compare the cost of drugs. And with that, we can move on to questions.
Okay, let's start some questions, and then I will save that informational thing at the very end, because we've got quite a few, but I think we can probably get through them pretty good. One of the biggest, most prevalent questions is, how soon can they register at wellmark.com?
So from my understanding is that once you get your ID card, that's going to signify that you are in our system, and then you can create your login. You obviously won't have any data in there yet because you won't have had any claims, but after July 1st, as claims start coming in, you'll be able to see those, and you'll also be able to see all the different resources and everything.
Okay, so, and as far as my understanding is too, the other question is, when will they receive their cards? Go ahead.
So the ID cards will automatically be generated once they are loaded into our system. So we're still waiting for that file to get loaded. And once that does, it's going to trigger the ID cards about 24, 48 hours later. And then it can take 7 to 10 business days for them to receive the cards.
Okay, so and with you saying that and kind of knowing what our process here with BHR, I believe the goal is to get everybody their cards by the 1st of July is the goal. So we'll kind of, we'll see how everything plays out, but that really is the goal that everybody is shooting for, both at BHR and Wellmark.
Exactly.
And so they'll have to wait until they get their cards to register. Is that correct?
Well, once they're actually in the system, they should be able to. They could even use their social, but when they receive their card, they'll know for sure that they are in the system. Okay,
so if they still haven't gotten their cards, and like if they want to keep checking, they just need to use their social to try to log in, or should they just wait to get their cards?
It would probably be best to wait, only because you know, they don't want to go out there every day and try and get in there. If they want to see what the Wellmark website looks like too, I know you and I had a conversation, you'll be posting a link to the demo site so they can kind of play around in there and see what everything looks like. And again, some of the features might not be exactly the same because it's going to be customized for your group, but the navigation is going to be the same, just so you can, I know I went through everything really fast. So that will definitely help you to kind of get more familiar with the site, or you can wait again until you get your ID card and then log in there and play around.
Okay, let's see how many questions that ended up answering. Okay, answering. Let's see. Is there a maximum lifetime benefit?
No, there is not. It's possible there could be on some services, but there's not a dollar amount on how much we pay out. I know in the old days, there used to be like your limit for medical claims was $1 million. We don't have anything like that on there. It's basically, the benefits are the benefits. If it's medically necessary, then it's going to be covered under the plan without a limit.
Okay. Can claims for out-of-network be submitted electronically, or is it only on paper?
At this time, it's only on paper.
Okay, and then there's the next one is, when can we register? We got through that. If a dependent turns 26 during the fiscal year, are they automatically dropped from my plan on their birthday, or will they be notified, or I be notified?
Okay, so typically when a dependent turns 26, let me find that here. So typically when a dependent turns 26, a notice would go out to the policyholder asking them to confirm if they are unmarried and under age 29. So if they're under age 29, I'm sorry, if they're a student and unmarried, they can stay on the plan, but the parent does need to return that form to Wellmark so that we can process it. And then they also, with a disabled dependent child, there's paperwork to fill out for that as well, if they want to keep them on the plan. And if it doesn't get returned, they will be canceled from the plan. And I believe that is the end of the month in which they turn 26, or if they're unmarried full-time student, 29.
So they will receive some kind of notification then?
Yes, because we'll want to give them adequate time to return information confirming if they are still a full-time student and unmarried. And that will go out prior to the dependent's birthday. So they will have adequate time to get that back into us so that there would not be a lapse in coverage. If it's not returned, then obviously they would get canceled. And then if they were able to return that information later, we can go ahead and get them reinstated.
Okay. Can the explanation of benefits be converted to a PDF or other format for submission to flexible benefits / spending accounts?
I think that when you save it, it does save as a PDF, because you can definitely download it. So I would, if you have the capability to save it as a PDF, yes. And the same with the temporary
Okay.
ID cards.
Okay. And then the website again is just wellmark.com. Is that correct? Or is there a special web address?
No, it's wellmark.com.
Okay. What if my doctor insists on the name brand drug after trial and error?
So that's kind of a multifaceted question. So if your doctor insists on the brand name drug and it's on the formulary, it's going to be covered. It's just going to cost you a lot more. Yeah, and you always have the option to go to a generic if you want to. But it's basically, if it's a covered drug, you're welcome to take that. Does that answer the question?
So basically, if that issue does arise, that will be something that they'll have to work with Wellmark on, is kind of my understanding.
Well, if it's a covered drug, they can still take it. If it's not a covered drug, it's not necessarily an option. The doctor can submit a formulary exception request, but it wouldn't get approved if it was just someone's choice. They just wanted to take that. The provider would need to submit medical documentation and show that this is why they can't take these other drugs. And then it gets reviewed and either approved or denied based on the information provided.
Okay, well, great. Thank you for that. If they already have a CVS account, do they have to create a new one, or can they use their old one?
I'm not 100% sure on that. I think they can still use the same one, but let me double check and I will get the information back to you, Michelle.
Okay, so I have two people that had that question. I'm going to quickly, it looks like they both have their names. I'm going to write those down quickly and get back to.
Like I said, I think they can keep the same one, but I want to double check and make sure that that's correct.
Okay, and I'll try to get back to these two folks that answered, asked, excuse me, that question. When are we able to, oh, we just did this one. It's a new question, but when are we able to register with Wellmark? We already talked about that because it does tell them right now that they need to contact customer service. So pretty much when they get their cards is kind of the answer to that. Yes.
Yeah, I would say when they get their cards or July 1st, whichever one comes first.
Okay. And we should, and like I said, the goal is to get the cards to everyone by July 1st.
Exactly.
Okay. Can you talk about the eye exam benefit and what doctors we can use for that?
Okay, so for doctors you would just do the provider search to find an in-network provider that's near you. As far as the benefit, it's going to vary by plan. And I believe that is, you get one per benefit period with cost share waived, and that would include refraction and contact lens fitting.
Okay, sorry, I was trying to respond to something. Let's see, is the identity theft program available to just the member or to the member plus covered family members?
It would be anyone in the family that's covered.
Okay.
So the adults would need to sign up for themselves. Children are automatically covered. There's no sign up for them because typically they don't have a credit history or anything, but if anything was discovered, they would be included.
Okay. Will there be insurance reimbursement for gyms?
No, but that Blue 365 discount program does have some discounts for gyms in there.
Okay. Oh, somebody did try using their social security number to log in and it didn't work.
Right. Yeah. Eligibility is not loaded yet. So I'll save everyone some time. I mean, if you want to go out there and play around and see how it works, feel free. But if you want to see how the website works, I'd probably use that demo that Michelle's going to have posted. But again, the eligibility is not loaded yet. So it'd probably at least be another week or so.
Okay. So, and that's, so yeah, so the answer to that is once you get your card, basically. Okay, next question. What if you are in the middle of a course of physical therapy treatment?
So, since your renewal is July 1st, you have visits under your plan and you're just going to keep going as you usually would. Obviously, you probably want to make sure your physical therapist is in network, and you can look on that provider finder. You can also call that health advocate line as well and ask them if a provider's in network, they can look it up for you. So, but yeah, it doesn't matter if you're partway through physical therapy or not, you would be able to continue on.
And this one, I already received 2 black ID cards that indicate they are insurance related. I'm not sure what that is. Do you know what that is, Amber?
No, we do not have black ID cards. Ours are white.
Okay.
I don't know what those would be. Where did they come from? Was there a company name on the envelope, or was it a solicitation maybe?
That's what I'm wondering. So it is an anonymous attendee that asked the question. So maybe if they get back in the Q&A, and yeah, it could be somebody just trying to sell you something.
Right.
But it's not Wellmark. They're not. Yeah, I didn't think so, but I thought I would ask just to help, we'll see if we can figure that out, or see if they can figure that out. I am due to deliver around July 1st. If a baby is born at the end of June and hospital stay goes beyond the 1st, how would that be covered?
No, I've had that question before and I can't remember what the answer was. So let me check on that one and get back to you.
Okay. And I'm gonna quickly share that other, before we get into more questions, I'm going to try to share my screen so that so that you can get the phone numbers and the website addresses and everything. Gosh, gotta figure out where it is. So that some of these questions that we're not certain on too, if they're ones that you really need to, probably very specific to your situation, that you would need to reach out to our benefits people.
And also, if
that up. Go ahead.
Yeah, if you do have specific questions that pertain to you, we do have our health advocate line open for you already. So if you know which plan you're taking, you can ask benefit questions and get answers to those benefit questions. You can find out about network providers, drugs, anything that you have questions on as far as benefits. They are waiting and ready to take your calls. So don't feel bashful. Give them a call. That was the number on the ID card. And I think, do you have it on here as well, Michelle, or no?
Okay, do you see my screen yet? Oh gosh, what's it doing? I see black, I see black screen.
Yes, I did see it for a moment, but oh, there you go.
Okay, we may have to use this view, guys. So, and that again was from an anonymous attendee. So a question like that, the one that we just addressed that we couldn't answer, the BHR website address is there, the phone number, and specific questions like that, you can actually send an email with the specific question to the benefits website at state.sd.us. And that would get you a more direct answer, and they can really do some research into your situation and help you find some more specific answers. All right, I was going to check and see where we're at, because I think people are probably going to need to be getting back. Oh, no, we've got 7 more minutes. Good. All right, let's try to power through some more.
Keep going.
Yes. Okay, how soon can I get my prescription medicines?
So you can get your prescriptions starting July 1st.
Okay, will there still be the 100% coverage, no cost to employee for certain preventative drugs?
I believe it varies based on plan. Anything that's ACA preventive, yes. Beyond that, I probably, if you have drug specific questions, would call the customer service number. Because we'd need to look up drugs specifically for the plan and the plan you've selected and the name of the drug to see where that would actually fall. And I can give everyone that 800 number again, because I know it's not up there. It's 800-846-9183. And then also, like Michelle said, you can email the benefits email right there, and they can certainly forward questions to me, but we would need the specifics for me to be able to answer that question.
Okay. Due to taking a maintenance drug, I will run into timing issues since doctor appointment is the 1st of July and will need to order or get prescription on the 1st of July. Any thoughts on what I will do so that I do not have an issue getting the prescription filled on time if I don't have the card on time?
Okay, so again, the goal is to have the ID cards everyone on or before July 1st. In the event that you do not have an ID card by then, you can call into the health advocate line, or if you email your benefits team at the state, they can get that information over to me, your information over to me, and then I can send them a temporary ID card.
Will BHR or Wellmark be sending a file to Discovery Benefits for FSA accounts? Do you know anything about that?
I am not sure. I know that behind the scenes, there's all sorts of stuff going on, but I suspect the state would be sending information to Discovery, but let me see what I can find out from my end and I will get back to you.
Okay. Can we buy vitamins and get reimbursed on the, oh, well, these are kind of specific HSA questions. I'm not sure if you'll have the answer to those.
Yeah,
Any
so
of these,
that's drug
yeah.
specific, we'd need to research those each individually based on plan and the name of the drug.
Okay.
Generally speaking, most over-the-counter stuff is not covered, but there may be some exceptions.
Okay. So
And
if
then
you,
that sounds like also it could be an HSA question.
and that's why I'm thinking maybe send it to benefits website at state.sd.us. So that, because that might be a combination of, we have two different people that might need to answer that question so we can get that answered, because it could be HSA and it also could be, our actual healthcare plan. So if you send that question on to this website, please, we should be able to follow up with that. Next one, does Wellmark do their own pre-authorizations or do they use a third party?
Okay, so for medical authorizations, we do have a team that reviews those internally. For pharmacy, CVS does work on those for us.
Okay. I do have another HSA or HRA card question. And I am going to refer this one, again, if it's in HSA, HRA, one of those plans, please go ahead and send questions to the benefits website at state.sd.us so we can get those answered for you if we've got some timelines for things like your new cards. I know that if you've never had one before, you'll be getting a new one, but if you have already currently have one, you shouldn't be receiving a new card, but we're going to get a lot of people who have brand new ones. So, but I'm not certain about timeline. What about glucose sensors? My particular brand is non-formulary. It's not really an option to not use it.
Okay, so, and this would be for a glucose monitor, correct? And you said it was a non-formulary. So this is one of the ones
Yes.
that I would probably need more specifics, like the plan that they've selected and the name of the specific sensor, so that we can research that and make sure we get accurate information. Because I know that the glucose monitors and sensors do fall under tier 2 of the pharmacy benefit, or they can be durable medical equipment from a medical supplier. But I don't want to just say, oh, yes, it's going to be covered, because I'd need the specifics just to make sure.
Okay, so that really would be another one to direct that question to that benefits website email so they can do some more research and then get back to you.
Right, because it's kind of a more specific question versus the general.
Sure. Okay, next, if my dependent is a 21-year-old living in Omaha, Nebraska, will she have any options for Nebraska for in-network doctors?
Oh, yes, there's a lot of providers in Nebraska. And you can also still look those up on our website if they're in network or not for your plan. And they actually contract with Nebraska Blue Cross Blue Shield, but we have a partnership with all of the Blue Cross Blue Shields throughout the United States. So they would just process the claims for us and have the contract with the provider, but your benefits would work exactly the same. So if they're in network with the Nebraska Blue Cross Blue Shield, they're going to be in network with us. And you should be able to search on our website for those providers in Nebraska as well.
Okay, if you go for a yearly wellness physical in July, does the physical the following year need to be made for the exactly 1 year later?
No, it is per benefit period. So July 1st through June 30th, you would get one per benefit period. So it just would need to be after July 1st of the following year.
Okay. If it's a tiered preventative drug, is it covered fully?
Again, that's a little bit more of a specific question. It's going to be plan specific, drug specific. I would need to look that up.
Okay. Okay. And again, reach out to that email address. Then somebody can get back to anybody directly with the questions. Let's see, is using CVS more cost effective than other pharmacies?
So CVS is just our pharmacy benefit manager, so they process our claims for us. You can go to actual CVS pharmacies to fill your drugs, but you can also go, if you're in Sioux Falls, you can go to Costco. If you're anywhere, you can go to Walgreens, to Walmart, to all the major pharmacies and some mom and pop places. You're not limited to just CVS. But how I showed you that cost estimator, it can vary. Your cost can vary by pharmacy. And it even can vary month to month, depending on who their supplier is and if drug costs changed. So I do recommend using that tool, or customer service can help you walk through that as well, like our health advocate team.
For the free identity protection, is that just for the year or while you're a member of Blue Cross Blue Shield?
It's the whole time you're a member of Blue Cross Blue Shield. So as long as you're with us, it's a free service. If you're no longer with Wellmark, you would no longer have coverage unless you signed up yourself and took the paid service.
Okay. Is there anywhere on your website that shows the cost of services, the discount, and what is cost if you don't have insurance? Case in point, with sleep apnea equipment, I can buy replacement masks for $25 online, but through insurance, my cost is $84 after insurance discount.
Yeah, so no, we wouldn't have any way to know, like not through the insurance, not through a participating provider. And I agree, sometimes you can find things cheaper outside of the insurance online sites. However, then you don't get the credit towards your deductible and out of pocket. If you tend to spend a lot during the year, you may want to still put it through the insurance if you typically meet your out of pocket, because that way you can benefit from that amount. And even though you might be paying a little bit more upfront, in the long run, once you hit your out of pocket, you could actually be saving.
So it looks like we went over time. So what I'm going to do is I'll reach out to Amber and try to follow up. We've got quite a few questions still that we haven't been able to get to. So as long as I don't show you as an anonymous attendee, I should be able to respond and reach out to you and get you some answers. If you don't hear back shortly, go ahead and reach out to that benefits website at state.sd.us for your question. Especially if you may or may not have registered as an anonymous attendee. And if we're not able to link your question to your email address. So I thank you, Amber, so much. And thanks everybody for all these great questions.
Yes.
Gosh, I wish we could have another 30 minutes to just get to all of them, but we'll try our best to follow up with all of these. You certainly can reach out to any of these phone numbers, email addresses, and go to the website that I'm showing on here. This will be posted on the website within 48 hours. We'll also have that link that Amber talked about to the trial, the demo, which it might be a really good idea to go take a look at that. We'll get that posted as well. We'll also post a PDF of the presentation so that you can see the slides. That might jog your memory for some questions or anything if you need to follow up later. But thanks so much, Amber, for doing this for us. And I'm sure that I'll be communicating with you a lot in the next couple of days to try to get some of these questions answered.
And thank you so much for having me. It was an absolute pleasure.
Thanks. Everybody have a great day.
Take care, everyone.